Okay, so we're going to discuss the role of group music therapy as an intervention for individuals, and we're going to be drawing from the article that we read, which was looking at it as an intervention for individuals with severe and enduring mental illness. So I'll spend a little bit of time talking about music therapy as a group intervention and then also dive into the Grok et al.'s 2009 study, which is exploring its impact on quality of life and social anxiety. So hopefully by the end, you can at least have a general understanding of the structure and goals of music therapy group. We'll talk about some of the key findings from the study and maybe evaluate how some elements of music therapy could possibly be applied to your practice in mental health, marriage and family therapy, and school counseling. So, music therapy is more than just listening to music. It's a structured clinical intervention, and it's used to help clients with emotional, cognitive, social, and psychological needs. Music therapy groups can be structured or unstructured with different techniques, including receptive therapy, which is listening and discussing music, active therapy, which can be creating music through singing or instruments, improvisational therapy, which is spontaneously making music, guided imagery, which is using music to explore emotions and process trauma. So, in your future professions, understanding how music therapy works and thinking about if there are ways you would want to integrate creative interventions into your work, I think is beneficial. I think that music therapy is particularly effective in group counseling settings. So, why? I think it fosters connection. So, even nonverbal clients can participate. It helps with self expression. So, clients often share emotions they struggle to verbalize. It can provide a non threatening, engaging atmosphere, reducing resistance to therapy, and it enhances group cohesion because participants work together to create and experience music. So, in your various fields, we work with clients facing social anxiety, trauma, depression, and behavioral challenges, and music therapy can be an effective alternative to talk therapy for these populations. The study by Grok et al. 2009 aimed to see if group music therapy could increase the quality of life and reduce social anxiety in clients with severe mental illness. So, unlike many other interventions, music therapy again doesn't rely on verbal communication, so it makes it very accessible to clients with cognitive or emotional barriers. In this case, participants had schizophrenia, schizoaffective disorder, bipolar disorder, and other psychosis, and were stabilized on medication. Why does this matter? Well, stabilization reduces medication related variables that could skew results. So the structured time limited intervention that they had, which was 10 weeks, allowed participants to engage in active music making while working towards a collaborative goal, which was recording a song. And the process was designed to foster creativity, teamwork, and self expression. So the final week included focus groups to understand participant experiences. The study found significant improvements in participants' quality of life, including feeling healthier, increased social support, more opportunities for leisure, and social anxiety also improved, particularly in eye contact and social interactions. However, psychiatric symptoms did not change, indicating the benefits were independent of symptom reduction. So, our key takeaway in this context of this article was that music therapy improves lived experiences and social functioning. Um, the focus groups revealed that participants value the therapy not just as a treatment but as a meaningful activity, and many were surprised by their own creativity. The group dynamic fostered teamwork, pride, and social connection, and some frustrations arose about session length, that 1 hour wasn't enough. So for all of you, I think music therapy offers non-traditional ways to engage clients. It can be integrated into group therapy even without formal music therapy training. So, for example, school counselors can use songwriting or lyric analysis for emotional expression. Mental health counselors can use guided music imagery for trauma work. I think it can be an invaluable tool. And, we look at it again through a group therapy lens. Guided music relaxation can help reduce anxiety and depression by using calming music. Lyric analysis encourages introspective discussions and helps process emotions. Music assisted guided imagery can support clients with PTSD or complex trauma, allowing safe and emotional exploration. And songwriting can help clients develop coping strategies and external difficult experiences. Personal favorite, group drumming creates social connection for individuals with social anxiety or depression. Improvisation, I think, provides an alternative to verbal expression, as do all of these, but for clients struggling with emotional articulation, it's might be a good way to go. And I think as counselors, these various techniques can be integrated into more traditional therapy or used in structured music-based support groups with a trained professional. So, music therapy in general provides an alternative approach to traditional talk therapy, particularly again for clients who struggle with verbal expression. If you look at cognitive behavioral integration, um, structured music therapy can reinforce cognitive behavioral strategies such as pairing positive affirmations with melodic repetition. If we look at music as a nonverbal processing tool, improvisational music therapy is particularly effective in trauma recovery, allowing for clients to externalize emotion through musical expression. In terms of effective regulation, things like drumming exercises have been used to help individuals with impulse control issues regulate their emotions. And social connection music can definitely facilitate group cohesion and trust in group therapy settings. So, clinical considerations, you should assess the client's relationship with music, potential associations with past trauma, and cultural implications when selecting interventions. But again, you probably would be doing this with a trained professional, right? So looking at it through the lens of school counseling, I think there's some possibilities here where music therapy can offer an engaging and accessible modality to address academic, behavioral, and emotional concerns. So you could look at incorporating music into social emotional learning frameworks that can support things like executive functioning, peer relationships, and emotional expression. When we look at behavioral and attentional challenges, rhythmic interventions like drumming exercises have been shown to to improve focus, self-regulation, and behavioral control in students with ADHD. Music-assisted narrative therapy, and so working to encourage students to write lyrics or select meaningful songs can help explore identity, resilience, and future aspirations. It can also serve as a regulatory tool for students with adverse childhood experiences, reducing hyperarousal and disassociation. So, practical methods into integrating music, into group counseling, or collaborating with music educators. I'm sorry, practical methods include integrating music into group counseling, collaborating with music educators, or creating curated coping playlists for students. Just some ideas. Uh, Music therapy and a family systems can work to address effective attunement, attachment, and communication dynamics. So, research suggests that musical co regulation, for example, synchronized drumming or singing, enhances emotional bonding between partners or family members. When you look at lyric analysis and conflict resolution, couples or family members can select songs that resonate with their relational experiences, using them as a starting point for dialogue. In multi generational family therapy, music can be used to honor family legacies while allowing for healing and differentiation. Shared music experiences such as singing lullabies or family music making can strengthen attachment bonds in parent child dynamics. And as per always, counselors must remain Really sensitive to trauma associations, religious or spiritual considerations, and client agency in musical selection. Music therapy has significant ethical considerations, so clients should have full autonomy over musical selections to prevent negative emotional triggers. Certain music may evoke strong traumatic responses, so counselors need to monitor client reactions and provide alternative grounding strategies. Songs carry different meanings across cultural and religious contexts, requiring sensitivity and selection. And while counselors can integrate music-based interventions, complex music therapy interventions should be referred to board certified music therapists. So, in resource limited settings, counselors can incorporate simple, structured music exercises without requiring specialized equipment or training. Music therapy has profound impacts on brain function, emotional regulation, and neuroplasticity, making it a really valuable intervention. Um, so, in terms of neuroplasticity and cognitive function, music activates multiple brain regions simultaneously, so it's strengthening neural pathways. Engaging with music can stimulate cognitive flexibility, particularly in individuals with neurological conditions, trauma, or cognitive impairments. Emotional processing in the limbic system. So, the limbic system, including the amygdala and the hippocampus, is highly responsive to music, making it an effective tool for trauma processing and emotional regulation. And studies have shown that listening or creating music can modulate fear and anxiety responses, reducing hyperarousal and PTSD. So, music also triggers the release of dopamine, the same neurotransmitter involved in motivation and reward. So, this is particularly useful for clients with depression and executive dysfunction, and it can help restore emotional responsiveness and engagement. Rhythmic synchronization between auditory input and movement has been shown to enhance motor coordination and emotional regulation, and drumming and rhythmic interventions are widely used to improve self regulation in individuals with ADHD, ASD, and mood disorders. Music also modulates the nervous system activity, so affecting things like heart rate, respiration, and stress hormone levels. Slow, steady tempos can induce parasympathetic activation, reducing anxiety and promoting relaxation, while upbeat rhythms can increase alertness and motivation. So, this neurobiological framework helps explain why music therapy is effective in mental health counseling, trauma work, and neurodivergent populations. So, music therapy should be intentionally structured within clinical practice to ensure effectiveness and alignment with therapeutic goals. It should always be goal oriented. Not all clients will respond positively to music therapy. Music can be integrated into CBT or DBT and narrative therapy to enhance engagement. And clients who are highly avoidant, dissociative, or resistant to therapy may benefit from gradual exposure to music interventions. So, counselors should consider the population needs, accessibility, and session structure when designing music based group interventions. For those interested in deepening their knowledge of music therapy, there are several pathways available. So, becoming a board certified music therapy is the most formal route. That's getting a degree in music therapy from an accredited program, completing a supervised clinical internship, and passing an exam. There's also training for counselors and allied professionals. So all of you can integrate music-based interventions without becoming full music therapists. Options include continuing education, courses, workshops, and certifications in expressive arts therapy. And many master's and PhD programs now focus on the intersection of music therapy, psychology, and neuroscience. So there's specializations such as neurological music therapy, which train professionals to work with neurorehabilitation, autism, and cognitive disorders. So some professional organizations, the American Music Therapy Association provides research, training programs, and advocacy. The International Association for Music and Medicine focuses on music's role in medical and psychological healing. And for those not pursuing full certification, courses on music assisted therapy, trauma informed interventions, and guided imagery in music can still enhance clinical practice, and I think this field is rapidly expanding. So there's growing research on music's impact on the brain and therapeutic outcomes. So continuing education in this area, I think, can greatly enhance counseling practice in a variety of settings. So to conclude, music therapy is not just for therapists. As counselors, you can integrate music into your practice in creative ways. And group music therapy is especially effective for fostering social connection and emotional expression. Music-based interventions can be used alongside traditional talk therapy to support clients. And consider how you might integrate music in your future work, whether it's in mental health, school counseling, or family therapy. Music is a universal tool for healing, so consider using it.